Hello and welcome. My name is Kristen Motley. I'm a pharmacist. I'm the founder of Health Educated, and I'd like to thank Mark Osterberry of the fantastic Philadelphia County Medical Society for partnering with me and doing all the behind the scenes work, him and Robert, to get this continuing education program offer you this evening. I'd also like to thank David McKeegan. I don't think he's on yet. He's from the Chester and the Delaware County Medical Societies, and he also helped to spread the word for tonight's event. If you are a licensed physician in Pennsylvania, you will receive 1.5 hours of Category 2 credit, and it is a renewal year, so I hope this is right in time for you. Instructions for claiming the credit will be provided at the end of the session. But in order to accurately document attendance and to keep track, we want you to type your first and last name into the chat. That will let us know that you were here. So please just type your first and last name into the chat. That will let us know that you are here. And if you dialed in, just unmute to share your name. I don't see that anyone has dialed in, so I think you'll be okay. Again, for everyone that's joining us now, welcome. We're just asking people to type their first and last name into the chat so that we can document your attendance. This is our roll call, so just type your first and last name into the chat and we will document your attendance so that you can get credit issued for being here this evening. Now, in order to limit any background noise, please remain on mute unless you are speaking or otherwise engaged in the conversation here, but please feel free to enter comments and questions into the chat. I'll be keeping an eye on the chat to make sure that our speaker knows the questions that are coming up as she's speaking. And you can also feel free to unmute during her presentation if you have a question that you want to ask directly. So I'd like to start by just explaining exactly how we got here. So the organization that I founded, Health Educated, is a nonprofit that was birthed out of the need to increase vaccination rates in Black and Hispanic communities. Now, I have been doing community health outreach for many years as a pharmacist and just volunteering my time for many efforts in terms of chronic health disease prevention and health promotion. So I had been doing that, but when COVID hit and the pandemic hit, it really prompted me to start an organization, to start this nonprofit so that I could get the funding to really make a bigger impact. And so I did that back in March. I'm still waiting on my determination letter for the IRS. So if anybody has any contacts in the IRS, please let them know. I did not get my letter yet. But anywho, I'm really excited for all the work that I am allowed to do through this nonprofit. And so that's what got us here today. So I applied for a grant through the Pennsylvania Department of Community and Economic Development to educate healthcare providers on empathy, and it got approved. And so that's how we're here. Now, how do we get to the topic of empathy? I'm so glad you asked. And really quickly, if anyone is just joining us, please type your first and last name into the chat so that you can get credit for your attendance this evening. So how do we get to empathy? Well, we got to empathy through that COVID vaccine hesitancy work that I had been doing. I had so many conversations with people, talking to people who did not want to get vaccinated. Again, a lot of my efforts in the Black and Hispanic communities. And I always ask why. That's my first question. Why? What's your why? Why are you not vaccinated yet? And I will also ask them, did you talk to your pharmacist about this? Did you talk to your healthcare providers about this? You know, what did they say to you about getting vaccinated? Because these are people who I was meeting on the streets because we would just go out into the community and have these conversations to help to spread the information to help get the vaccination rates up. And so these people didn't know me. So I'm like, well, did you talk to people that you know, your community pharmacist, your PCP? Who are you talking to get information from about this? And they would say, yeah, they did talk to their doctor. And one person said that her primary care physician said to her, well, I got vaccinated, so you should get vaccinated too. And so I said, okay. And then we went through that conversation. I had another conversation with someone else that said that that their doctor said to them, well, you got vaccines for your kids all along, and they have all their other vaccines, so just go ahead and give them the COVID vaccine too. And in those conversations and just hearing how people shared those stories, I felt that a lot of those responses were missing empathy. People weren't really feeling heard. So that just put that in my mind that we needed to do some training on empathy. And so another part of that grant, I had an opportunity to create a radio ad. And one of the projects on the radio ad was for me to write a script. So like I wrote a script and I got an actor to read the script, and I want to play the radio ad. And then I'm going to tell you what happened after I played this at a focus group. All right, here it goes.
Hello, please leave a message after the tone.
Hello, this is Dr. Johnson. This message is for Michelle. Michelle, I see you haven't gotten the COVID-19 vaccine yet. I understand this is a difficult decision for you to make. And obviously, I know there's so many things to consider. Especially the long history of African American people being treated unfairly by their healthcare providers. I understand this caused a lot of mistrust. We were wrong, and we're trying to make things right by making sure everyone has access to the COVID-19 vaccine. If you want, you can also look up Dr. Kizzy Corbett. He's an African American scientist. He led the team that discovered one of the vaccines. So I realize you have a lot of questions, so I'm here for you. The thing is, I really want you to be protected, and I want to make sure you have all the information you need to make a good decision. We don't want you to suffer and possibly die, especially since we have a vaccine. So give me a call back at the office and we can talk about this. Take care. Bye-bye.
So that was the first draft of the script. So I threw everything in there because I wanted to get some feedback from the focus group to see what did they feel, how did they receive a message that may sound like that. So I had a group of about 10 people. They were all African American, maybe one Hispanic was there, I believe. And I asked them, what did they think about that? And one thing that came out of that conversation was, my doctor would never care that much. And that broke my heart. And it was really then that I was like, we as healthcare providers need an empathy booster so that we are making sure we are connecting with our patients in a way that they know that we absolutely care about them, their health. And it just blew my mind that was the first thing that came up. So I redid the script. They also gave me some other feedback. And I know I put a lot in that because that was just like everything that I wanted to share about it. So I redid the script and I toned it down a bit. And so this was the final version of that radio ad.
Hello, please leave a message after the tone.
Hi, this is Dr. Johnson calling for Michelle. I see you haven't gotten the COVID-19 vaccine yet. I know this is a really hard decision, and you probably have lots of questions. So if you want to talk about it, just give me a call. Bye-bye.
So I just, pulled out a lot of the information. I pulled out some of the empathy. I left a little bit in because I just couldn't help myself, but I wanted to make it realistic. So I didn't want a person to hear that and just completely disconnect with it because they would say that, that's not how my doctor would ever talk to me. And so I wanted to get your feedback on, what do you feel hearing this story from me? Is there anyone who wants to share? Is there anyone who has something to say or to add to this conversation about that?
Hi.
Hello.
Good evening. I'm sorry, my face is not showing, but I'm Diane Hyman, and I'm an oncology nurse with over 20 years of experience working in oncology at a local hospital across the water. And thank you for the invitation, Dr. Walls, to hop on this Zoom on today. The conversation is so needed, is so necessary, and I just applaud you for doing this, and I'm excited to continue in this discussion. Empathy, just working out, not just with COVID, but just as a healthcare provider and cancer and every area of healthcare. This is a topic of discussion that we definitely need to spotlight. And so I thank you for this opportunity just to even jump on and be a part of this discussion.
Thank you, Diane. Thank you for being here. And Thank you all for being here this evening. So we're not going to focus on empathy as it relates to COVID vaccine hesitancy tonight. Like, that's not going to be the complete focus. We'll have a much broader conversation, but I just wanted to let you know how we got here this evening. So now I'd like to introduce my friends and colleague, Dr. Kathleen E. Walls. Dr. Walls is the owner and founder of The Greatest Counseling and Consulting, located in Philadelphia, Pennsylvania. She is also a strategic business partner with Taga Consulting. She is a psychodynamic trained and systems-oriented doctor of clinical psychology. She is a consultant, a counselor, a therapist, a coach, a professor, an author, media personality, Instagram queen, teacher, preacher, and just everything else in between. She is so amazing, and I know you are going to enjoy this session with her. So welcome, Dr. Walls.
Thank you. Hello, everybody. Hopefully y'all can turn your camera on at least for just a moment and just wave so I can see y'all for a little bit. And there's, Dr. Motley, you asked them, hey there, you asked them to put what in the chat room? So for those who are just joining.
Yep, for anyone that's just joining, please put your name, your first and last name in the chat. So if you want credit for being here this evening, just put your first and last name in the chat, please.
Okay. And I would also love for people to put their location. Where are they joining us from? Because I see some people that are in the country and out of the country on the call. So I'm excited. So I thank everybody for joining us tonight about this topic, which I think is very important and can translate across professions, right? It's really about relationships when we're talking about empathy. And so I am going to start, before I start my slides, for those who know me, I'm very interactive, so I'll be pulling on you. For those who don't know me, I am a former early childhood and elementary and middle school teacher, and I believe in engaging people. Okay, so don't be surprised if I call on you. I usually love when the camera's on because it's about reading body language, right? And seeing the impact. And this is also what this topic is about. When we're talking about empathy, it's that ability to read what is being said as well as what's not being said. So Diane, you mentioned being an oncology nurse. And there was, in my research, I came across this one story that I said I was going to start with. It says, the day I, and this is a male patient, was diagnosed, I was seen by a person from the counseling team. I told her that I need to get my kids to talk to someone. And she said, well, I'm busy doing programming next week. And if you want to talk to someone sooner, I'll get someone from one of the other cancer groups to contact you. And I said, what do you mean, other cancer groups? And she said, well, we divide our counseling up by the kind of cancer you have. It seems a little odd to me that it is based on the kind of cancer I have, because it's not the kind of cancer that's concerning me. It's the fact that cancer is killing me. When I was finally contacted, I said, so which cancer group are you from? And she said, I'm from the breast and ovarian cancer group. What I wanted to say was, you know what? When my ovaries need cancer counseling, I'll give you a call. All right. So the power and the importance of empathy and really connecting with people with where they are, needless to say, goes unsaid. So let's take a look here. I'm going to start sharing my slides. So wait, I need a sec. I love acronyms. All right. So wait, I need a sec. I need sympathy. I need empathy. I need compassion. If I've come to you, I need you to activate these things. All right. And one tends to lead into the other. Today, what I want us to focus on and our objectives are going to clarify the difference between sympathy, empathy, and compassion. Many times they're used interchangeably and they are not the same thing. So we need to understand what is the difference and how this might impact the ability to provide quality healthcare to patients. We're going to learn the different types of empathy and recommendations on how to demonstrate each one. So there's cognitive, there's emotional, and there's compassionate empathy. And sometimes you'll also see other ones. Today, I also added somatic empathy in there as well. We're going to discuss and explore the impact, value, and role of empathy and compassion in the patient-provider relationship. And we're also going to recognize how demonstrating empathy and compassion impacts and influences patient retention, attrition, trust, and increases the implementation of treatment recommendations with regard to care plans, medication adherence, COVID vaccines, etc. You know, it was interesting in the research when you come across the first principle of the American Medical Association medical ethics. It says a physician shall be dedicated to providing competent medical care with compassion and respect for human dignity and rights. So it's starting off this way. And many times, like I said, I'm a former early childhood and elementary school teacher. So I love that because I'm looking at the building blocks of education. So many times we come across words that we're familiar with, but we don't take time to reintegrate ourselves with the actual definition of these words. And what do they mean to us now? And then what do these words actually mean when put into action? Back in 1997, Daniel Goleman, who has done a lot of research on emotional intelligence, wrote, "Medicine is a field slowly awakened to the benefits of empathy, in part for some compelling economic reasons. In a day of heightened competition for patient loyalty, those physicians who are better at recognizing emotions in their patients are more successful in treating them than their less sensitive colleagues. Physicians, of course, need to sense the anxiety and discomfort of their patients so they can treat them effectively. But a study found how rarely they listen. Patients usually had an average of 4 questions in mind to ask, but during the visits, they were able to ask just 1 or 2. Once a patient started speaking, the first interruption by the physician occurred on average within 18 seconds. Physicians who don't listen get sued more, at least in the United States. Among primary care physicians, those who had never had a malpractice suit were shown to be far better communicators than their lawsuit-prone peers. They took time to tell their patients what to expect from a treatment, to laugh and joke, to ask the patient's opinions and check their understanding, and to encourage the patients to talk. And the time needed for a doctor to successfully be empathetic was how long? Ooh, let's see, what are some guesses? You can put it in the chat. You can take yourself off mute. How long do you think it took them to be successfully empathetic? Dr. Barry, what do you think?
I agree.
How long do you think it took them to be empathetic?
Too long.
I have one in the chat that says 18 seconds.
Okay, a little bit longer than that. Thank you, Felicia. Others, let's see. Let me get two more guesses. So we got too long, we got 18 seconds. Dr. Bay, what do you think? How long did it take them?
I don't know. 15 minutes?
Ah, Diane Hyman said 15 minutes too. Less than 15 minutes. We're going to round out with one more. Leslie Young, how many minutes do you think, or how long do you think it took?
About 7 minutes.
All right. So we were on Price is Right. Leslie, it will go to you. It took 3 minutes. 3 minutes. So not that long. And she's saying, yay. Look. So it took 3 minutes. And that's important to understand, because a lot of times when we think of that empathetic relationship, we think that it takes a long time to build it. And I know a lot of times there's a healthcare agency that I work with, and their providers really only get 15 to 20 minutes per client based on the system that they're in. And so they're thinking that it's got to take a longer time for me to build this relationship. But the research is finding it doesn't take that long. And so there's 3 minutes within 15, 20 minutes. So it's there. All right. The whole thing is, it's just about being intentional. All right. So in one study in 2016, what was found is that it was recommended that all health professionals be trained in compassion, that compassion be considered and evaluated as a core competency of healthcare providers, and that system-wide standards of compassionate care be adopted and implemented. They found that there is a gap between patients and clinicians' perceptions of compassionate care. It requires consideration. If we're looking at compassionate care, we have to understand that it requires consideration of the sufferer's perspective. Patients felt compassion stemmed from virtues of genuineness, love, honesty, openness, care, authenticity, understanding, tolerance, kindness, and acceptance. And lastly, that virtues functioned as antecedents to healthcare provider compassion, whereas suffering was the corresponding patient antecedent in the compassion equation. So the virtues are critical, that the provider is showing these, and that the person who is experiencing suffering is not feeling as though they're suffering by themselves, that the provider is joining them in this process, in this journey. So if we take a look, there's actually what is considered a spectrum of empathy. And as you can see on the axis, it's the amount of output as well as the amount of understanding and engagement. So when we look at pity, low effort, low engagement. I'm just feeling sorry for you. We start to move up in the effort and the understanding and engagement with sympathy. We're saying, I feel for you. We move into empathy, where now I'm feeling with you. And then lastly, compassion, I move by you. Now, I'm always thinking, all right, how can I make myself understand this more, right? What are the mnemonics that I can use to help integrate this into my memory? So as I looked at pity, I see the I. So, right, it's about me. I'm sorry for you. It's more self. I'm focused. I'm not really focused so much on you, all right? Then the sympathy is I feel for you. Again, it's starting to move towards you. There's a Y in there right now, closer. It's starting to move towards you, but it's still more about how I'm feeling. All right. Now, then there's the empathy. Now, what I love about the empathy is it's EM. EM is backwards for what? Me. So the empathy starts inward. It starts with yourself, and then it moves outward. So I'm not disappointed or upset about pity and sympathy, because it's activating my feeling state. And that's what we need. We have to get it activated first. But then with empathy, we have to shift it now and connect with the other person. So I'm feeling a certain way about the situation. That's fine. But how are you feeling about the situation? And now I'm connecting with how you feel about it from your life experience and what's going on with you. So in the story that I read in the opening, the gentleman talked about having to go get his children. So now I have to connect with him as a male, as a father, going to get his children, receiving this diagnosis. How is this going to impact his life? How is the treatment plan going to impact or interrupt his day-to-day, right? I'm empathizing. I am getting an alignment with how this person is experiencing this diagnosis as well as this healing journey. And then compassion. When we look at the prefix com, C-O-M, that is working together with someone, right? Now that's moving. So that togetherness means it's me and you. We're going to come together. I move by you. So empathy and compassion become almost, I was thinking about them, I'm like, they're like siblings, almost like fraternal twins in the sense that there's a lot of similarity there, but there's enough difference for you to tell the difference between the two. So compassion has empathy in it, but compassion has now moved me into action. There's something that I want to do to make a difference than just feeling the feelings that you're experiencing. Any thoughts or questions?
Can you hear me?
I can hear you. Is there anything that any questions that anybody has or any comments that you want to make? All right. So let's start looking at the difference here, right? So sympathy versus empathy. First, sympathy, the feeling that you care about and are sorry about someone else's trouble, grief, misfortune, etc. Understanding from your own perspective. I know how you feel. How many times, put a 1 in the chat room if you've ever heard somebody say, oh, I know how you feel. Or you can put a thumbs up in your reactions. And when somebody says that to you, how many times has someone said, you have no idea how I feel on the inside? Your social graces may not allow you to say it out your mouth, but you're saying it internally. If that has happened to you, put a 2 in the chat room. And many times what happens is, right, you have no idea. That's right. Many times people are saying you don't know because you haven't taken the time to know who I am, the unique individual of my life experience. So this is where sympathy is fine because it's activating feeling states inside of you. We need that. But then we have to be careful because it is not empathy. You're not, right? You don't even know me. So how are you going to say, I know how you feel? The other thing with sympathy, which is interesting, is that the research finds that it can involve judgment. And we know that when people experience judgment, they have a tendency to shut down. There's a lot of fear around judgment. So we have to be very careful when it comes to sympathy. On the other hand, we have this beautiful thing called empathy. Now, with empathy, this is the ability to sense other people's emotions, coupled with the ability to imagine what someone else might be thinking or feeling. Share someone else's feelings. Now, the key thing is here, you're imagining. Until you clarify, you don't know for sure, right? So this is the importance of the check-in. I can only imagine how you're feeling. I'm thinking you might be feeling like this. Correct me if I'm wrong, which is inviting the person into the conversation. They don't have to worry about the social grace of being rude or not being polite by saying, no, that's not how I feel. You're giving them permission to say, and you're letting them know that you want to engage with them. So now with empathy, you're understanding from the other person's perspective. I feel how you feel, and I'm feeling with you. You become more aware of the other person's feelings instead of focusing on your own, and it tends not to involve judgment. Empathy helps a person to feel heard, understood, and validated. And this communicates you are not alone. And so I see we have a lot of healthcare professionals and people also who interact with other individuals. And how important is it to know that you are not alone? It's a top priority for people to know this. And especially when they have received the diagnosis or they're going through something, whether it's going to the dentist. Some people find that very traumatizing, right? So for somebody to take the time and show empathy towards them, it helps to say, okay, I'm not by myself here. Jenna Kisling, licensed clinical social worker, said empathy becomes the bridge that connects two people together and creates a space for more genuine healing, understanding, and compassion. By working on our empathy, it allows us to hear others' points of view and spring us forward into automatically becoming more helpful. Remember, empathy is leading us into compassion. Compassion is basically empathy in action because now we're doing something. Empathy is being supportive, understanding, and compassionate are the building blocks to preventative care for all individuals, both young and old. So it doesn't matter how old the person is, they need to know that they are supported and someone is caring for them and about them and connecting with them through this journey. Because also remember, when given a diagnosis or something, the person is not feeling like themselves. And so there's that disruption and that turbulence within themselves as well. So to be able to go through this healing process, this medical process with somebody, that's providing them more support. Rasmus Hugard stated that empathy and compassion are represented in different areas of the brain. Empathy is the brain's wired tendency to identify with those who are close to us, close in proximity, close in familiarity, or close in kinship. When we empathize with those close to us, those who are not close or even different seem threatening. Now, these are my words in parentheses, where biases can be activated. And this becomes so critical because now we're in this world where people are really paying attention to and putting an emphasis on DEIA. And so now we have to understand where the biases come in. I know so many people have gone through unconscious bias training, and then it becomes a matter of, all right, what do we do now? Now that our biases become conscious, we're moving from unconscious into consciousness. Now what do we do? When we're looking at empathy and we're wondering, why do I feel more empathetic towards this one person, but not empathetic towards this person? That means we got to do some self-reflection. We have to increase our self-awareness. So see, empathy is composed, and compassion is composed of the self-awareness, the self-reflection, moving this stuff from the unconscious into the conscious. As Dr. Motley mentioned, I'm psychodynamically trained, which means I come from the Freudian line, where things are constantly moving from the unconscious to the subconscious into the conscious, so that we can change things that are not working for us. So now, again, there's some clients who you feel closer to, some patients who you feel closer to, and some who you feel more distant. When you are feeling distant from them, trust and believe they're feeling your distance. All right. So those are spaces that you have to check yourself and you have to see what is getting in the way. When unchecked, empathy can create more division than unity. With empathy, we join the suffering of others who suffer, but stop short of actually helping. With compassion, we take a step away from the emotion of empathy and ask ourselves, how can we help? As I mentioned earlier, there's different types of empathy. So cognitive empathy is the ability to understand another person's perspective, right? To be able to see it from their point of view. But this is all heady, right? We're just focusing on the intellectual aspect of empathy. It's focused on thought, understanding, and intellect. It's understanding sadness versus feeling sadness. And if you've ever been in a sad place, are you interested in somebody saying, oh, I understand that you're sad, and go about? No, you want somebody to actually connect with you and soothe you and provide you with something that's going to help make you feel better. But the cognitive piece is just like I said, that leaning towards the intellect. The problem with it, obviously, is it can seem cold. The person may feel detached, feel as though you're detached from them. All right. So it is considered often that the person is under emotional. There is insufficient feeling, and that the person is unsympathetic. Then there is emotional empathy. This is the ability to feel another person's emotions, the joy, the pain, the fear, the love. So, when I'm thinking medically, somebody who wants to have a child, the joy in having this child, right? Someone who doesn't want to have a child, there may be the fear, right? A complicated pregnancy, there's the pain, right? So you have all of these things going on, and to be able to connect with this person's emotions. Obviously, this can be overwhelming. When you are connecting empathically, empathetically, emotionally, it can be overwhelming. And sometimes people are worried about what is considered emotional distress, right? It now becomes too much for you to even bear. This is why it is so important to know yourself, to do the self-reflection, to increase the self-awareness, to work on emotional regulation, to work on emotional IQ. All of this becomes very important because you have to understand your emotional state versus the emotional state of the person that you're working with. Now, it talked about emotional empathy being deeply rooted in mirror neurons. And I'm going to show a quick video on mirror neurons. And these are really kind of like vicarious sensations in some instances. Can you hear the sound playing?
We can hear, but we can't see it.
Oh, okay. Let me stop then.
But when you look at the detail.
Thank you. All right. Now you can see?
Yes.
Yeah.
Okay.
But when you look at the details of how these neurons, the system of mirror neurons, how it works, then the exciting discoveries unfold. So if I were studying your mirror neurons, what would happen is if I did an action that was just totally random, your mirror neurons would not fire. If I did an action which had kind of repetition to it even, you may not be able to figure out what I was intending to do after just one or two repetitions. But if I were to take an object that would signify to you what I was trying to do, like this bottle of water, just notice what your feeling is. So you may have noticed that the feeling was very different when I had a bottle in my hand versus when I was just moving my hand in a similar way. What that tells us is that when you know the intention behind an action, a different system in your brain is activated. We now know that that system involves the mirror neurons and other areas of the brain, so that what you do is you follow a sequence of action. And when you can predict that sequence, you can determine what the implication of that sequence is. So when I have a bottle in my hand, you know I will continue to drink like this, not toss it at you, for example. That ability to understand the sensory implications, that is what you're going to see, of the motor actions that you're perceiving, allows you to create a map in the mind, if you will, that's correlated with neural firing patterns in this mirror neurons superior temporal area complex that creates a neural representation, a neural map of my intention in your head. In other words, beyond just seeing behavior, we see the intention beneath the behavior from the very beginning. Now, that's how we create the human capacity to imitate behavior.
All right. So these mirror neurons, let me stop sharing and come back to the other. All right. So a couple things that he pointed out, which is very important. He talked about the sensory implications. So somebody's coming into your office, they're seeing you, and they are checking your eye contact, they're checking your body language, and they're perceiving you as you are interacting with them. And they're making links in their brain about what your language, what your verbal language, as well as what your body language is communicating to them. And this is determining whether or not your empathy is genuine or whether it's pseudo. All right. And so we're talking about empathy with integrity. Remember, we talked about the virtues in the beginning. We're talking about the authenticity. We're talking about honest empathy. And so you have to combat against things that are working in the brain the moment the person sees you and interacts with you. Are they feeling like you actually are connecting with them? Are they feeling like you actually care about them and want to get to know them? Or are they thinking that you are just doing this because it's your job? And you can think of times where you've been in hospitality situations, or maybe in the doctor's office yourself, when you've had someone who genuinely cares about you versus when someone is just doing it because that's what they were told to do when you walk in. Okay. So this has been seen as vital. This emotional empathy has been seen as vital for those in caring professions, such as doctors and nurses, to be able to respond to patients appropriately. Of course, as I mentioned earlier, you got to be careful of empathy overload. All right, that's empathizing too much. It can lead to burnout. And the problem with that is it can also cause us to become hardened, thus not responding appropriately, and then be considered uncaring. Some additional types of empathy are somatic empathy. And this has been described as those often seen in the medical professionals who can sometimes look at someone and they know what's wrong, or touch them gently and they know what's wrong. Also, somatic is that you physically feel in you physically feel in our bodies another person's experience. And that one is very interesting. So for instance, when you are watching a game now, I might be getting myself in trouble here. I'm not a big Eagles fan. And that's partly because I get very frustrated and upset with them. All right. But when you're watching your favorite sports team or watching an event, and you notice your heart starts racing just like their heart starts racing. All right. It's this idea that you have connected in that space. I used to be a basketball player. I don't watch a lot of basketball because next thing I know, I'm like jumping through the screen, like, put me on the court, put me on the court. I can feel the ramp up coming. All right. So this is an empathetic moment. I have connected. I know how that person feels. When I see missed opportunities on the court or on the field, I feel it. And I'm like, oh my goodness, there is an empathetic connection there. And then there's compassionate empathy. We not only understand a person's predicament and feel with them, but are spontaneously moved to help. The type of empathy that we are striving for is this compassionate empathy. It honors the connection of both felt senses and intellectual situation of another without losing our center. So it's the best of both worlds, right? We understand what's going on. We feel what's going on. And together we bring those two pieces together, and now we come up with an action plan on how to solve this situation. Using our emotional intelligence to effectively respond to a situation with loving detachment, because even though we're feeling it and we're understanding and we're working towards it, we also understand that it's not ours. All right. And that takes time and practice to be able to do that. Empathy versus compassion. Continued empathy is considered the reflexive and automatic part of our psychology, which originates in the emotion centers of the brain. Empathetic feelings, thoughts, and decisions are generated mostly on an unconscious level, which means we are less aware and less intentional about those decisions. Empathy is the tendency to join in others' suffering, particularly those who are close to us. But empathy is limited, and we need to understand that. One study found that when it comes to helping outsiders who are suffering, those not seen as familiar or friends, our brains perceive it as hard work and might reject the effort, which is why practice in being intentional is important. And again, as I mentioned before, if you're not feeling connected, you have to take time to see, what is it about this client? What is it about this situation that is keeping you from being connected? Sometimes with empathy, it is evoking feelings in us that we don't want to experience, right? That we don't want to process. It's triggering memories in us about maybe our life circumstances and or our fears. And again, this is why the self-reflection and awareness is important, because we have to understand that and recognize that. If we don't, it will impact our treatment, which ultimately then impacts the treatment. It'll impact our treatment recommendations, which of course ultimately impacts the treatment of the person who we're trying to help. Compassion, on the other hand, is considered reflective and deliberate. It originates in the cognitive centers of the brain. Compassionate feelings, thoughts, and decisions pass through filters of consciousness. Compassion is the joining in others' suffering, irrespective of their social or personal identity. It is the perspective that in any person's suffering, there is common humanity, regardless of cultural background, sexual orientation, or age. In the moment, you are similar to the other person. And when someone is coming in for help, that's what they want to know. They want to be able to connect. It can trigger other positive outcomes like improved collaboration, trust, and team loyalty. As Dr. Motley talked about in the beginning, as she shared the radio clips and information from the focus group, people were like, oh no, my doctor would never sound that kind. They would never sound that caring. They would never reach out to me and try to connect in a way that would help me understand. And as Dr. Motley and I did several public speaking engagements and getting people to move past vaccine hesitancy and so forth, the information that people shared about the lack of relationship that they had with their primary care physicians, the lack of relationship that they had with their healthcare providers, really became overwhelming and startling. And I remember one panel that we were doing, and one of the physicians was so shocked to receive that feedback. And he was just like, wow, this patient doctor rapport is huge. And some people were like, I don't even think my doctor knows who I am. Versus I can talk about my mother's doctor, who was my father's doctor before my father made his transition. And he's been a part of our family. And I email him, he emails me back. If I don't hear from him, I know that something's wrong. This has been our relationship for 6 years now. All right. There is a rapport there. He knows who I am. He knows what I do. He asks about my brothers. There's a relationship that's there. And when I tell people that, they're shocked. He's also shared things about me, to me about him. I know that he had a child. So when I talk to him, I ask him how his child's doing, right? There's a relationship that's there. So when he shows compassion, I believe it because there's a foundation to stand on. So this team loyalty, I do see him as a member of my family's healthcare team. And so we have to look at how are we connecting with people to make sure that they're a part of our team. My clients call me, they text me, they email me, they let me know all types of things that are going on in their life throughout, beyond our 1 hour session time, because they know I am a part of their health team. My father was a veterinarian. I cannot tell you the number of people who called him when they were getting ready to give birth to their children. Not their puppy parents, but to their children, or something was going on with a family member, because they knew that my father cared. They knew he was compassionate. They knew that he would help them. All right. There was that relationship. So compassion is intentional and it is solution focused. It has been found to be restorative versus draining. We receive medically, the research found that we receive a hit of dopamine when we deliver help. And so since helping feels good, we are motivated to do it again. Dr. Stephen Treziak mentioned that when he was in medical school, he said, we were warned not to care too much. It will burn you out. The advice was that we ought to be distanced to have an emotional shield.
Through the biomedical evidence,
All right,
and we did
stop
that.
and put this one on. I'll back that up. And Dr. Treziak has done a lot of research around compassion. He has a couple books out that are really good.
Through the biomedical evidence, and we did that.
Let me take it back.
You look through the biomedical evidence, and we did that in curating all the evidence for compassionomics. You see that burnout and compassion are associated, but it's inverse. So the preponderance of evidence in the biomedical literature shows an inverse association between compassion and burnout. If what I was taught in medical school, don't care too much, you'll get burned out. If that was true, it'd be associated in a positive direction, meaning high burnout, high compassion, low burnout, low compassion, right? There's inverse. So high compassion, low burnout, low compassion, high burnout. So some people want to just jump to the causation argument to say that burnout crushes compassion. But after going through all the available evidence, the preponderance of evidence in biomedical literature, we see that it's much more likely that it's actually the opposite that's true. So it's the people who have more compassion are more resilient and have resistance to burnout. And why is it? Because they connect more with patients. They get the benefits, like they get the good part of taking care of patients, the uplifting part of taking care of patients, like what it means to take care of patients. They get all of that. They get those benefits. So yeah, they have a stressful job. They either, really hard work, super busy, high stress environment. Yes. But when they connect with their patients, that's building resilience in them and resistance to burnout. Whereas if you don't connect with your patients, then all you have is a super stressful job.
Thoughts, comments, before I continue on. Dr. Motley, what's jumping out at you?
Well, I mean, that last statement in terms of the burnout and the compassion, the inverse relationship is very interesting. That's the first time I heard it presented like that.
Mm-hmm.
And it's, you know, it's great to see that it's backed up by the literature, by data. So it's not just an idea or a theory, but it's real.
Yeah. Yeah. Robert, I could see you shaking your head. Was there something you wanted to add?
Oh, I just agree with Kristen. I think it's an interesting perspective I didn't hear before, and I think I can see that the truth in that.
Mm-hmm. Diane, I saw you coming off mic. Something you want to add?
Yes, absolutely. I had too have never heard that what Dr. Traziak just said about the benefits build resilience. And I can see that now at years of facilitating the breast cancer support group and working with that population and thinking that I'm hitting burnout, but then it's identifying with them and compassion that keeps me going and keeps me, you know, from really not experiencing burnout, but I've never heard that put that way. And so that was very profound for me.
Good, good. All right. So let's take a look. So Dr. Traziak, he mentioned some other things as well. He said the more compassion, the lower the risk of burnout. That was the last quote that he said. He said, I started to connect more, not less, leaning in rather than detaching. Very quickly, I started doing my job better. I got excited about being a doctor again. And that was when the fog of burnout began to lift. He went on to say that scientific evidence shows that serving others, even showing simple kindness, is the best medicine for yourself. It is associated with tons of benefits for physical health, mental health, emotional health, and happiness and fulfillment and well-being, as well as professional success. He also stated that there's also evidence that having purpose in life, typically serving something bigger than ourselves in a meaningful way, is associated not only with longer life, but also lower risk of cardiovascular events, lower risk of stroke, lower risk of losing cognitive abilities later in life. It can actually help preserve physical functioning late in life. Jennifer Lerner, who is a psychological scientist and the Thornton F. Bradshaw Professor of Public Policy, Decision Science and Management at Harvard Kennedy School in Massachusetts, stated across time and situation, humans need empathetic skills and empathy in order to make societal cooperation possible. And in a time like the present, when the COVID-19 pandemic and brutal acts of racism are causing so much suffering, it's important to accurately perceive what others are feeling, even if we don't share those feelings. And this is where that genuine empathy with integrity becomes very important. All right, there's so many things that are happening in this world when a person comes in and their blood pressure is high, when they're stressed out, when they're having conflicts in their relationship. We have to be able to tap in with them from their life perspective and see what is going on, feel what they feel in that moment so that they feel like they're not alone, and then shift, as we talked about, right? Shifting from empathy into compassion. Dr. Motley, is there something in the chat room you want to highlight?
Yep. Naomi said, now stopping to think about the different fields that are associated with high burnout, she realizes there's also a high tendency of disconnecting, like in human services and education and fields where people are like quitting their jobs left and right.
Yeah, that's big time.
And then Jerica, I may have said your name wrong. Jericia. You knew I was going to say it wrong. Thanks, Jericia. She says that she's in education and she can relate as well.
Okay. So yeah, it's definitely, and that's the thing, right? A lot of people have been experiencing burnout for the last 2 years. The pandemic just pushed it over, right? But people had been on that trajectory of burnout for a while. All right, another quote that came from the Compassion in Healthcare article that was done in 2018, 2016, there's some as well. It says patients and family members consistently identify components of compassion, such as receiving care that is person-centered, responsive, and dialogic, as indicators of quality care, with healthcare providers and institutions characterized as compassionate, being less likely to receive patient complaints and malpractice suits. Now, this was just done, like I said, 2016, 2018. That's the same that was discussed back in 1997 that Daniel Goleman talked about. That when a patient feels as though their doctor is focused on them, is responsive to their needs, and is in dialogue with them, they are seeing it as they are receiving quality care, they are receiving compassionate care, and they are less likely to complain, and therefore less likely to have the malpractice suits. So how do we build? Oh, go ahead.
I'm sorry. I was going to say, and likely more likely to be compliant to doctors' suggestions, recommendations, because they have a trust with the physician.
You got that right. Dr. Wade, that sounds like you. Is that you? I couldn't see.
That's me.
Okay. Thank you for joining us. That's 100%, right? And this is why we want to build this relationship and this team, because you know that this person on your team is on there to help you win. And so if you're going to say, hey, look, you need to take this medicine. Hey, look, you need to do it 2 times a day for this amount of time. I'm more likely going to take it because I believe you actually care about my well-being and you're not going to give me anything that harms me. So absolutely. So building empathy and compassion, how do we do this? As I mentioned earlier, we got to increase our emotional intelligence, right? We have to be aware of how we're feeling and what's leading us to feel this way. And then also the other piece of emotional intelligence is being aware of how someone else is feeling and being aware of what's leading them to feel this way. And sometimes that person doesn't know. So you end up becoming a teacher in that moment. You're increasing your self-awareness. You're increasing your self-management and emotional regulation. And you're also cultivating feelings of warmth, tenderness, concern, and connectedness. And you notice, and how do you got to notice the embodied sensations that accompany these feelings. So whenever I'm working with clients, I tell them, I need them to TFF. And what is TFF? I need to know what their thoughts are. I need to know what their feelings are, their emotional state, and I need to know what their feelings are, their physiological state. Because whenever we have any type of life event, we have thoughts about it, we have an emotional reaction about it, and it hits us, it makes its presence known somewhere in our body. All right. And so we have to connect with what do these feelings feel like? What do these thoughts feel like? And so as we cultivate this awareness, when I come into contact with someone and I notice this feeling sensation in my body, it's like, the last time I felt this was when I was working with Miss So-and-so and she felt this way, right? And now we start to build a connection. Now, we're also looking at strengthening relationship skills. Many of this you already know. I will just go over it for the sake of going over it. We need to be curious and cultivate curiosity. One of the things that we were taught in school is that the client is the expert. So I come in very open. I'm interested in learning about you. I'm going to be curious. I'm going to challenge any prejudices that I have and discover commonalities. I'm trying on another person's life just for a moment to see what I'm thinking, to see what I'm feeling. Why am I looking at this situation that way? So as we, as Dr. Motley and I talked to different people and they said they didn't want to take the COVID vaccine. And it was like, why? And they talked about, specifically in Black and Brown communities, they talked about the history of the healthcare system not being for them, not caring about them. Why do they care about us now? They just trying to kill us off in mass numbers. I mean, there were just so many thoughts, and because of past history. And then when we remained curious and we asked more questions, they realized that, hey, wait a minute, they're actually engaging with us. They're actually listening to us. They're actually hearing what we're saying, and they're seeking understanding. And by doing that, it was amazing, because what was it? Within 24 hours, Dr. Motley, somebody who was adamant about not getting the vaccine showed up the next day to get the vaccine. All right. So because the relationship was built, the rapport, what did we learn? It takes 3 minutes. 3 minutes for a compassionate connection. And that person felt that. So also, we want to make sure that we stay present, right? We got to stay focused. We have to stay engaged and actively listening, both verbally and non-verbally. Whenever I'm working with clients face to face, one of the first things I do is I turn the cell phone upside down. Because if it lights up, it's going to capture my attention. Now, if I'm dealing with an emergency, I let them know I'm going to keep it face up because I'm dealing with an emergency. If I look at my phone, it's only because of the emergency, not because I'm ignoring you. I set the precedence. I put disclaimers, preambles, whatever you want to call it. I call it informing the person. So because I want them to know that my attention and my focus is here. If the phone rings, it just rings because I'm right here with you. Make eye contact. Allow someone to speak from start to finish. If you need to interrupt them, I let my clients know sometimes I may need to interrupt you. I'm not being rude. I'm stopping you for a reason. I set the precedence from the beginning. I ask clarifying questions, right? You want to repeat back what you've heard in your own words to make sure that you've understood them correctly. Want to avoid reactions based on assumptions, and then focus on listening and understanding instead of judging. Dr. Motley, is there anything in the chat room that needs to be pulled up?
Diane mentioned a little bit ago that patient satisfaction scores are likely impacted by the lack of compassion and empathy as well. I think she mentioned that when you were talking about the lawsuits. And then Naomi just put in the chat, when one feels you are feeling dismissive of their feelings, it diminishes any trust that was there or could have been built.
You got it. That is the absolute truth. And that's exactly what the research found as well. So Dr. Trezier talks about the 10-5 rule, and this is that if you walk within 10 feet of someone, acknowledge them with a nod or a smile. If you walk within 5 feet of someone, say something, even if it's just hello or nice day. And then he went on to say, so many times we are head down, faces in our phone. Now, how many people know that's true? Let me get a 1 in the chat room. Let me get a thumbs up. If many times you're so busy face down in the phone and not paying attention to the people. All right, yes. And so, but the research has found that on average, people have 9 opportunities for empathy per day. 9 opportunities. The homework, the teacher inside of me says, I want all of you to see if you can get at least one day where you hit that 9, where you're able to show empathy at least 9 times within the next week. And then, of course, build on it. So Dr. Zaki from Stanford said, empathy helps us see past differences and allows us to see others who are different, a different race or a generation or ideology from our own, without the lens of stereotyping, prejudice, or bias. People who experience empathy also tend to be less stressed and depressed. and more satisfied with their lives, happier in their relationships, and more successful at work. If you remember early on, we talked about how empathy, it's easy, right, to connect with someone who you know and to be empathetic. It's a little bit more challenging to be empathetic with someone who you don't know, who you see as an other. But the power of empathy is you move past it, right? You move through it now. And this is how the race, the generation, the age, the ideologies become irrelevant. Those are blocks to empathy. When you move past it, now you have moved and connected with people on a human basis. So, compassionate care is something that came up in the research. And what is it? It is a relationship based on empathy, emotional support, and efforts to understand and relieve a person's distress, suffering, or concerns. Compassionate care helps you better understand their needs and what your patients are going through, right? In the moment, as they talked about that guy, he talked about receiving that diagnosis. What's happening for him in that moment? The reality is, you know this as professionals, when you get that type of news, your body starts to shut down. You done moved into fight, flight. You don't even remember a lot of things that's said. If you go back and ask people when they receive a cancer diagnosis or any type of diagnosis, they're like, I don't even remember what was said. I always tell people when they're going to the doctor to receive information or news like that, make sure you take somebody with you. I also recommend that they record it on your phone. You can open up the voice app so that you can play it back, because the moment you receive that information, you have shut down, you have gone internally, and you've gone into your internal chatter as well as your emotional state. All right. And so we have to remember that as providers as well. So you may have to repeat yourself several times on different occasions in order for the person to finally know what the information is that you're giving them, but also to be able to integrate what has been said. Compassionate care is giving patients someone to talk to, which is especially important for patients who don't have family or friends to lean on. Many times we're thinking they'll be able to get support from other places, but everybody doesn't have a support system. I remember asking one of my mentees, I said, well, who do you go to in your wisdom circle? She said, I don't even know what a wisdom circle is. I said, well, when you need sage advice. She said, well, I don't have one of those. And I said, oh, okay. So everybody doesn't have a support system. So we need to find out who is your support. And sometimes we, the providers, are the support. Compassionate care helps prevent health problems and speed up recovery. As we already talked about, they're going to be more likely to follow the treatment regime. And just knowing that someone's supporting you is healing within itself. It creates higher satisfaction in patients. It saves time and cost. They feel heard, understood, and cared for. Compassionate care is a sense of satisfaction and effectiveness in the personal, higher confidence and coping skills in them. And lastly, it can improve cooperation between individuals and teams and between patients and healthcare professionals. From the Philadelphia Inquirer, they said compassion can be a powerful, beneficial therapy for the giver too. Among healthcare workers, more compassion was associated with more resilience and resistance to burnout. To go back to the study, the compassion in healthcare study, it says these findings suggest that compassion as experienced by patients is both situational and dispositional, requiring healthcare providers to invoke their personhood along with their clinical proficiencies to have an optimal effect in alleviating patient suffering. So see, I have a relationship with you and I'm bringing my expertise. That creates a win-win situation. So all in all, what's it come down to? Remember, it only takes a sec to have a positive impact in and on the lives of others. All right, Dr. Motley, I'm gonna turn the mic back over to you.
Thank you, Dr. Walls. That was really informative. And I think for me, one of the biggest takeaways was the compassion part, because I can kill it with some empathy all day long because I just feel and I understand. But the compassion and the action that goes with that, for me, adds another level that I need to start working on. This was really, really good. I enjoyed it, but I want to open up for questions. What questions come to mind?
I have this is Jerecia Hand. I have a comment and a question, if I may. Again, I'm in education, and the loving detachment and the idea of avoiding burnout by being more compassionate really stood out to me, because sometimes I think I'm an empath because I shut down because I feel so much in the world. And even though I'm not practicing the utmost compassion at work at times, that doesn't stop me from feeling what the students and other people are going through. And these are adult students. I mean, not that that's, any better, but they're not little kids. But I still feel what they're going through. So it does resonate with me to go ahead, be more compassionate, but that also requires being in the moment and not being preoccupied with the next email, with the next student coming in, with whatever my boss is asking and all of that. And I guess my question for Dr. Walls, and everything was great, thank you. How does one protect him or herself or their self as a professional in one of these caring fields? When they care so much or have personal things going on, but then there's a desire for them to be available, compassionately for other people.
Yeah, thank you for your feedback and for your question. So, it's a couple things. Number one, you have to tap into your body and know when you're feeling drained, right? Because the moment you start to feel drained, then that's like unplugging. So if you think of it like a cord, you want to unplug it from source. And so remember, when it comes to compassion, it is the combination of heart and head. So this is a time where now you got to move into head and move into problem solving. The ability to tap into and connect with other people's emotions is great, because it's like, okay, well, if I'm feeling this way now, how can I help alleviate that feeling? What do I need to do next? So I'm thinking educationally, as a former professor, when my students would be, having meltdowns because papers were due, but they waited until the last minute. I know what that feels like. I've been there, done that. And so what do I do now? When a semester starts, I tell them the story about waiting till the last minute and what that feels like, and the way in order to pace themselves so that they don't have to experience that feeling, and a way to self-correct. So by connecting emotionally to a situation, that's giving you intel that now you can shift it into problem solving.
Thank you both for that. What other questions or comments come to mind? Feel free to unmute, and you have some love in the chat there, Dr. Walls. You can check it out now.
Oh, okay. Thank y'all. Thank y'all.
Other questions or comments?
I have a comment. First of all, the session has been excellent and very informative. It is tricky because it seems like those in these professions start out in these professions because of the compassion. And because of the capacity to be an empath. And when you talked about empathy, having empathy as opposed to sympathy, it sounds like, well, that's a good thing, empathize. But then we quickly run into the danger of compassion fatigue because we stay in empathy mode, and it becomes detrimental to us because of all of the feelings and taking on the burdens and all of the empathizing that we can do. So I view it kind of as like a dead end. It's a dead end road. Whereas compassion on the other hand, has the rainbow at the end of the road because it gives the reward. And so that's that restorative feeling that will fuel you to keep going despite the challenges of your profession.
Yeah.
And so the question, I guess, is, just as the other young lady just mentioned, what are the tools to shift from empathy to compassion? And I think you hit it on the head with action. And that's the main thing. If you don't stay in empathy, but you proceed to action, because with empathy, you're just feeling with the person. You're not helping the person and you're not changing the circumstance.
That's right.
So now both of us are depressed.
That's right. Right.
But when we move into action, then we both win, because now I've helped you and I've helped me, because I can see the light at the end of the tunnel for you. And then, it will motivate me to continue on the journey.
Yeah, because, right, Dr. Wade, that ends up being, if you stay in the empathy too long, right, then now you have empathy distress. And both of y'all are drowning in that sense, right? And so you're absolutely right. It's that shifting. Now, this is also why know thyself is important. That self-awareness, working on self-regulation and emotional regulation is important. Working on that emotional IQ is important. How many clients can you see a day, right, without going too long? What does it feel like when you've tipped over into I'm drained now and emotionally in a place where I don't feel centered, grounded, healthy, or helpful? Then now I have to come back out. And what do I need to do to come back out? Do I need to go for a walk? Do I need to talk to a friend? Do I need to watch something funny? Do I need to journal about it? Do I need to do some deep breathing, some mindfulness, some yoga, some Pilates? Like, what do I need to do to recenter and balance myself? And this is why we have to know what are our coping skills so that we can restore ourselves as well.
I think you are talking yourself into another session, Dr. Walls. I want to point out that Enid had mentioned he's done a lot of work in the compassion territory with his patients, and tend to set boundaries between head and heart when interacting with patients.
Yeah. So, Enid, did you want to come on and say anything? You would just want to leave it in the chat? We can't hear you. Okay.
Okay.
Okay, there you go.
First, I want to thank you, Kathleen, for inviting me to this session. This was remarkable. This is right down my alley. I'm a nurse, and I work a lot of hours, and I work 40, 50 hours a week. And I know on Monday, I am extremely empathetic, very sympathetic. But by Thursday, I'm setting boundaries because I know I can't take much. And I know I can't hear much and I can't absorb much. So I set boundaries. I take little bits at a time and I just try to be present. And then I will go to the head, try to get solutions for the patient. And it's a win-win, but I have to tap in and know where I am at the time. And then I do the things such as mindfulness. And by Friday, I'm totally mindful, meditating, walking away. But that's how I handle it, and I love it. And I just want to say, getting back to the physician that talked about, I'm not burnt out. I love what I do for hours, 40, 50, 60 hours a week. I love it because I'm very engaged with my patients. I'm very engaged with them. And I have these young nurses that say, oh my God, you work so much, don't you get tired? Yeah, but it's not a physical, it's more like a physical tired, but I just wake up in the morning and want to go back.
You're refreshed and rejuvenated.
Yeah.
Yeah.
So it really, that the empathetic and being empathy and compassion, it does take the stress away. And then knowing yourself and understanding, you know, when you're shifting or when you're not shifting, you got to do something about it at that time.
That's right. 100%. Thank you, Enid.
You're welcome.
Thank you for that comment. I am just mindful of the time here. And I just want to say thank you, Dr. Walls. Thank you to everyone who is on the session for pouring into yourselves this evening. I know that it is late and you are all still here. And so thank you for doing this for yourself. In case you missed
Dr.
it,
Motley, I want to say, and it's really late or early in some places. So we have some guests from Uganda.
I saw that.
And Bermuda. Yes.
I don't even know what time it is in Uganda, but good morning to you in case it's morning. That is awesome. That is awesome. So in case you missed it at the beginning, if you do want to get CME, you get 1.5 hours of category 2. Just put your first and last name in the chat. We will capture it there and make sure that the certificate is emailed to you. I also wanted to mention, if you live, work, or play in Philadelphia County, Delaware County, or Chester County, be sure to join one of the medical societies there. I'll put the links to their websites here. If you're not already a member, please be sure to join. If you'd like to partner with Health Educated on any projects related to seeking to improve health literacy, decrease health disparities, or increase health equity, that is like my passion. I'm all over that. You can feel free to shoot me an email and connect with me as well. I'll put my email in the chat. But thanks everybody for being here. We are out. It's over.
Thank you, everyone.
Thank you.
Good night.
Good night.